You are watching the Good Morning Portugal live stream with me, Carl Munson, where we have taken the decision to keep you in touch with the coronavirus situation. One really good place for doing that. We share all our links to do with the coronavirus on our Twitter feed, which is My Portugal News. But a very good source, a very safe source of information, it would appear, not unsurprisingly, is Safe Communities Portugal, and I'm hoping to talk to them on Friday the 13th, would you believe, 2 days' time. We will have a chat with the people at the Safe Communities Portugal site and community organisation, basically. But this is a good source of information. Look at this. There is an update from this morning at 0800 hours, and I'll just go through this with you. For those who join me on the live stream, obviously we're looking at the websites together, but obviously in the podcast you can just hear this, and you may want to share it to somebody who doesn't have access to the internet. You could take the podcast to them, play it to them. For people who are visually impaired or partially sighted, this might be quite useful as well to hear the information if they're not seeing the live stream. The European Union apparently will provide 25 billion to support companies and avoid the risk of an economic crisis due to the coronavirus. That's pretty far-sighted and very necessary, I would say. Portugal, currently there are 41 confirmed cases and 375 suspected cases of coronavirus here in Portugal. The National Council for Public Health will decide, it appears today or very soon anyway, if all Portuguese schools will close immediately, thus anticipating the Easter holidays. So, that was coming anyway, wasn't it, that the kids would be off school, but that may be closed ahead of the Easter holidays. A group of health professionals at Villanova do Familiação Hospital is in isolation after contact with 2 suspected cases in COVID-19. The information was confirmed to the agency Lusa, the news agency. Metropolitano de Lisboa informed that it will be reinforcing its cleaning and disinfection efforts of the spaces most frequented by passengers due to the coronavirus. This is interesting, according to the president of the Chinese League in Portugal, I didn't know there was such a thing, and they must be really feeling the heat at the moment. Some shops and restaurants owned by the Chinese community living in Portugal will close for a vacation. That's probably wise. In statements by Wiping Chow to the Lusa agency, is mainly family businesses that are at this point feeling a big break in business. Adding it is a temporary thing. They should open next month. And that'll be affecting the Chinese shops all over Portugal. It's a very Portuguese phenomenon, the Chinese shops that you find in the strangest nook and cranny of the country, and I'm sure their business has been affected recently. European Council met Tuesday by video conferencing. 4 priorities established. A, the exchange of information between the various countries to prevent the spread of the virus. B, the adoption of EU measures to ensure the supply of protective equipment, individual and medical supplies. C, coordinated action to invest in research to find a coronavirus vaccine. And finally, D, to ensure a clear response to prevent the epidemic from affecting family employment and income. That's a really serious matter. And we have to take a kind of we don't have to, but I think it's wise to take a longer term view. And for me, it's really important to be considering the scenario after this. We really need to be very careful now about flattening the curve, which I will show you more about that later on in the show. But the whole thing about prevention at the moment is really important. People have been saying this, and we have started to take them seriously, because we don't want the sort of spike and implications that we've seen in Italy. In the UK, British Health Minister Nadine Dorries was diagnosed with COVID-19 yesterday. She's been in isolation since the test was positive and confirmed in a statement that she's following procedures as specified. British health officials are trying to find people who may have been in contact with the minister in recent days. That's going to be pretty obvious to people, isn't it, if they've met Nadine Dorries in the last little while. And of course, she is probably with her cabinet colleagues and even the Prime Minister there. In Spain has enacted exceptional measures, especially in the Madrid region. All educational establishments are closed for 15 days, and all sporting events will take place behind closed doors. And I think in Portugal, that is the recommendation as well. We'll have a look at that in just a moment. Italy, 168 people have died with COVID in the last 24 hours. The record number of fatalities in the past 24 hours brings the total number of fatalities in that country to 631. In total, Italy now has 10,149 confirmed cases of infection. In France, Air France have suspended all flights to Italy between March 14th and April the 3rd. My goodness. Okay, so that's a good place to go. Safecommunitiesportugal.com. Talking to them on Friday. You can ask questions yourself of Safe Communities Portugal when they join us on the live stream on Friday. So how are you doing? Where are you? How are you in relation to the coronavirus? Are you in self-isolation? Are you socially distant? Have you always been socially distant? But at the moment, are you keeping away from crowds and so on? Or are you still one of those people who's just saying, oh, it's just the flu? Really? I don't think that is the case. Obviously, it's your life. It's up to you. But this is the thing at the moment. What we do is having an effect on other people. And that's the really important message at the moment, I think, is to understand how, as you move around the community, you are affecting the way this might go, the graph, the curve of the spread of the infection. And if we can nip it in the bud now, we're going to save ourselves a lot of problems later on, it would seem. Okay, so further information from Safe Communities Portugal, who are also on Facebook. You can find them on there as well. And this is useful information, more specifically in, let me just get rid of that, around Portugal. This is the directives that have come from the DGS, the Director General of Health, known as the DGS here in Portugal. It is considered that mass events can contribute to the increase in the spread of the infection, and with the priority of protecting public health, the following guidelines are established. The cancellation or postponement of mass events should not be viewed with alarmism, but with prudence and responsibility that is required of all at this time. There you go. This is collective responsibility. These guidelines are effective immediately and apply until April the 3rd, 2020, being reassessed according to the epidemiological evolution. Well, we're all learning a lot more about science at the moment, aren't we? Number one, postpone or cancel all events that involve or may involve the concentration of more than 150 people in municipalities where there are clusters or outbreaks with secondary transmission of COVID-19, or when there are confirmed cases in relation to which the epidemiological link cannot be found. It just seems like good practice, doesn't it, to not be in big groups of people. Postpone. Number two, postpone or cancel all events that imply or may imply the concentration in close space of more than 1,000 people. Three, postpone or cancel all events that, even with a concentration of less than 1,000, imply or may imply the participation of people who were present in the last 14 days in areas where there is active and sustained community transmission of the virus to date. Italy, China, South Korea, Iran, Japan, and Singapore, which can be updated epidemiological evolution. Without prejudice to the previous guidelines, postpone or cancel all events that occur on the air-free outdoors and that involve the concentration of more than 5,000 people. The Directorate General for Health, number 5, also recommends that all people observe social distance, hand hygiene, and respiratory etiquette. Isn't that a beautiful turn of phrase? Respiratory etiquette. Do not cough or sneeze on other people in all circumstances that include clusters of people of any size. Okay, so you can go to all the w's.dgs.pt. Obviously, that's going to be in Portuguese, and that's great if you can read Portuguese. But this is what we're doing here on the Good Morning Portugal live stream and podcast to keep you updated in terms of and through the English language here in Portugal for the expat and immigrant community here in Portugal. So that's it really for the update and the news. Have a great day if you're leaving at this point. I'm going to stick around and slow things down a little bit so that we can discuss the sort of bigger picture and maybe go into a bit more discussion or consideration, opinion about this. Okay, but important format change for the show is that, yes, in the first part of the show, quick look at the weather. Always good to look at the weather, and then a news and information update. Then we'll slow it down a little bit, and we'll start talking among ourselves here with any luck. Who are you? Where are you? If you tuned in, please do use this as a focal point. Please use this as a way. If you're socially distancing, here's your chance to be sociable and have a bit of a network online. Use the Positive Portuguese News in a group that we have as well, just to stay in touch with people and to discuss this between terms. I think we need to be very careful, mindful, and supportive of our own and other people's mental health. And obviously, this is a big change for people in all kinds of ways. But I think the social isolation, staying indoors and staying away from people will bring effects and implications that we haven't thought about, because that's how we human beings work, isn't it? We have an idea of how things will be, and then there's the reality of how we might cope with that. So do use this as a resource. I want to show you the curve that we were talking about earlier on. Some very good articles actually that are circulating at the moment, and one of them for me is the sorry. I'm going to show you. Yeah, this is a great article, but a lot of these I'm going to share via the Good Morning Portugal website as well. If you go to COVID resources, I think is the name of the link I've given it. Yeah, we can slow down a bit and have a look through this bigger article, longer article about some recommendations that seem quite sensible. And there does seem to be a little bit more of a respect. Maybe it's a desperation in listening to experts and people who know what they're talking about. Okay, and I know that's quite a hard thing to navigate and discern, and we've got our sort of inner sense of that, but we've also, part of that is a rational scientific approach of seeing what people's backgrounds are and what they've been talking about for the last few years or decades and what their field is. And this struck me as being quite a reliable source of information. Fast.ai, making neural nets uncool again. I don't know what the hell that means, but these people, I think, like looking at numbers. Scientists who like looking at numbers. They're quite important people at the moment. COVID-19, your community, and you, a data science perspective. So here you go. Jeremy Howard and Rachel Thomas, data scientists, analyzing the data. Won't read the whole thing to you. It's kind of academic, but the headlines are good. We need a working medical system. Yes, that's pretty much a no-brainer, but they go into some detail like that. They also discuss how this is not like the flu. Okay, that is a sentiment I think that's being slowly destroyed. This is not like the flu as we know it year to year. Okay, which we know kills a lot of people, and we know that vaccines are available, and whether or not you believe that they're effective or not, we are on top of it. That's the thing. That's why, to me, it's very different to the flu as we know it, because we know it. We know the normal seasonal flu patterns. We do not know a lot about coronavirus. It's very novel, new, and we are getting to grips with it. That's why, for one reason, it's not like the flu. But they go into greater detail about why it's not the flu. Okay, and they also say, "Don't panic. Keep calm" is not helpful. Now, I don't think they're suggesting people should panic. One common response we've seen on social media, they say to people that are pointing out the reasons to be concerned, is don't panic or keep calm. This is, to say the least, not helpful. No one is suggesting that panic is an appropriate response, although it is a very natural one. It has to be said. I was talking to Will Thompson about this. Panic is part of the curve of when things dawn on you. You have a panic response. It's perfectly natural and human and very normal to panic when you are contemplating things or receiving information that is very new and disturbing to you. To keep panicking is not good, and to work on your panic response is advisable. But these guys say, for some reason, however, keep calm is a very popular reaction in certain circles, but not amongst any epidemiologists they had, whose job is to track these things. Perhaps keep calm helps some people feel better about their own inaction, or makes them feel somehow superior to people who they imagine are running around like headless chickens. But keep calm can easily lead to a failure to prepare and respond. In China, tens of millions were put on lockdown, and 2 new hospitals were built by the time they reached the statistics that the US has now. Interesting. Italy waited too long, and just today, when this was written, Sunday 8th of March, they reported 1,492 new cases, 133 new deaths, despite locking down 16 million people. So I think they're not really saying panic, but they are saying get very proactive, deal with this, don't chill, step up and rise to the occasion and do the necessary. And this is what I started with on today's update. It's not just about you. This is I think, a community issue now. And this is why, if we scroll down to the curve, this is what we don't want. This high peak. We need to flatten that out so that we have a chance to deal with what seem like inevitable numbers of casualties or people, infected people, and so that they can be treated effectively. If us, the fitter ones, take the measures to not become infected and not spread the infection to the more vulnerable, that will help the medical services and the people caring for people who are ill. That will give them a better chance. It will cut the numbers down. And that's why this whole flattening the curve thing is really important. Because if we can slow down the rate of infections, it says here, in a community, then we give hospitals in that community time to deal with both the infected patients and with the regular patient load that they need to handle. This is described as flattening the curve and is clearly shown in this chart here. Sorry if you're hearing this on the podcast, but there is a big bell hump, as it were, and there's a flatter one. We want the flatter one. Okay, so that's Fast AI. I'll put a link to that in the resources that I've prepared for us on goodmorningportugal.com under the COVID-19 resources tab. You're looking at the and maybe listening later to the Good Morning Portugal live stream and podcast and YouTube channel, trying to get this information out for people who speak English or who prefer to receive the information in English in Portugal. It may, of course, be useful to you if you're elsewhere in Europe, as we discuss these more general ideas. One thing I want to share with you before I go this morning is an idea about how coronavirus, and I was saying, what's the prognosis? What's the longer term view here? We should really look at this and see what this whole phenomenon is bringing us, because it's not about the virus, I think, necessarily. I mean, of course it is if you're affected directly by it, but there is a much bigger picture here. There is a bigger picture about how precarious we are finding we are in terms of how how society is managed. We don't have the capacity for dealing with the amount of infections, it would appear, and that's understandable. We can't be constantly geared up for that. But then when you look at how we're premised in terms of our working lives, our economy, our supply chains for food and so on, we really see how unresilient we are, how precarious we are in our societies. And, who does that benefit? Interestingly, these are the questions that can be asked at the moment. And goodness knows, we might have a bit more time on our hands to ask them whilst we find ourselves in isolation, splendid or not. This is a slightly random angle here. I don't know what Design is. I'm guessing it's a design website. I'm finding information from all sorts of sources, but this struck me as an interesting angle. Coronavirus offers a blank page for a new beginning, says Lee Edelkort. And it goes on to say in this article on Design.com, DEZEEN, the coronavirus epidemic will lead to a global recession of a magnitude that has not been experienced before, but would eventually allow humanity to reset its values, according to trend forecaster. Okay, she's a trend forecaster, is Lee Edelkort. Edelkort told Design that the virus was causing a quarantine of consumption and would have a profound cultural and economic impact. That I can't see how that could be denied at this point. People would have to get used to living with fewer possessions and traveling less, she said, as the virus disrupts global supply chains and transportation networks. Now, this is, to me, is the interesting thing, how it is affecting us and how it's going to affect us in the longer term. And for many people, it's bringing about the circumstances that they want in the world, albeit in a hideous way. Okay, and, let's face it, that's how human beings tend to be, right? We don't necessarily take the medicine or do the things we know we might do that might be best for us, and it often takes some sort of external shock or event, and this may well be it. She goes on to say, quarantine of consumption. It seems we're massively entering a quarantine of consumption where we'll learn to be how to be happy with a simple dress, rediscovering old favorites we own, reading a forgotten book, and cooking up a storm to make life beautiful, she said. And I agree with that, but I do have to say it does also reek of first world privilege as well. It's both things, but I think she's also got a point. Some people have had to be happy with a simple dress and rediscovering old favorites and don't even have access to books or food to cook up a storm with. So, let's not be too first world privileged about that. But let's also understand that, a picture is coming our way that we may have, people who are interested in voluntary simplicity, living closer to the land, living a more simple life. Embrace that now. It would be my suggestion. That's what I want to do. That's what I want our efforts to be about, on the social network here, about how we're doing that. We're being forced to do it, so we might as well take it in and make the most of it rather than feel like it's being imposed on us, because that's not a good condition for human beings, is it, to have to do? I mean, this is why the prison riots are happening, I think, is because if you imagine putting to one side the rights and wrongs of why people might be in the prison in the first place, but if you were incarcerated, locked up by a government, and you thought that the infection would spread in the prison, you would feel so powerless, would you not? And that's why I was seeing, pictures in Italy of families outside prisons wanting their relatives to be pardoned and freed, because the prisons are just obviously a breeding ground, literally, for all kinds of things, but including, infection of disease. But your sense of powerlessness and how you are being controlled would be so vast and great. And that's the point I'm making here, is that we can feel forced to do things, or we can embrace them voluntarily and make them our own. And I'm suggesting we do the latter. Hopeful for a better system, carries on Lee. And this is where I'm hopeful for another and better system to be put in place with more respect for human labor and conditions. And this is Lee Adelcourt, who runs the New York City forecasting agency, Adelcourt Incorporated, in this piece in Dezeen.com. Okay, I think I'm going to leave it there for today. Thank you for joining me. I hope the update is useful. Let me know how it can be more useful. That's the format. We start with a news and an update of information, a bit of weather across Portugal, the more factual database stuff, and then we go into a bit more of discussion and hopefully a bit more of a support network for people who are slowly coming to terms with this coronavirus phenomenon and the possibility of being at home more and their lives being disrupted inevitably by this. So do let me know and stay in touch via Portuguese Positive News group on Facebook, and wherever you can comment. I'll pick it up on social media. Let me know how I can make this service useful to you. Take care, stay healthy, stay positive, stay close to the ground in Portugal. Carl Munson signing off. Take care, bye for now.